Assalamu alaikum. Today we will discuss about the dysfunctional uterine bleeding. Chronic heavy and prolonged uterine bleeding is a common gynecological problem. It is ovulatory or anovulatory. Chronic heavy or the prolonged uterine bleeding can result in anemia, which interferes with the daily activities and raise concern about the uterine cancer. Average menstrual cycle is 7 days. The amount of the menstrual blood loss is about 35 to 40 ml per cycle. Menorrhagia is defined when the blood loss is more than the 80 ml. It is ovulatory or anovulatory. Approximately 10 to 35% of the women report with the heavy menstrual bleeding. Iron deficiency anemia is developed in these patients. Excessive and irregular bleeding can detract from the quality of the life. Too many women and the bleeding may also interfere with the sexual activities. This is the pathophysiology of menopausal transitions. In menopausal transition, there is a history of the heavy or the prolonged bleeding due to the uterine structure abnormalities and endocrine abnormalities. There is a known uniform pattern of the endometrial shedding which leads to the irregular, prolonged and heavy menstrual bleeding. Endometrial hyperplasia or cancer may also present. Abnormal ovulation is another common endocrine pattern observed in the women during the menopausal transition. How we will evaluate the patient with the dysfunctional uterine bleeding? Confirm a uterine source of the bleeding on physical examination. First of all, we take the history, then on physical examination, then by performing a pregnancy test, assess whether the patient is a premenopausal or postmenopausal. Menopause is defined as the 12th month of the amenorrhea in a woman over the age of the 45 in the absence of the biological or physiological causes. Evaluate the pattern, volume, duration of the blood loss. Ovulation can, we must ask about the ovulation by asking about breast tenderness, bloating, pelvic discomfort, mood changes and thin vaginal discharge, or by serum progesterone level which measured during the luteal phase of the menstrual cycle. If the serum progesterone level is more than the 4 nanogram per deciliter, then it confirms the ovulation. We must perform the laboratory testing for the anemia and coagulation profile. If the patient gives the history of the easy bruising, bleeding from the mucosal surface, personal or the family history of the blood transfusion or coagulopathy. Perform the pelvic ultrasound to assess for the uterine or the other reproductive abnormalities that may contribute to the uterine bleeding. Sample the endometrium to exclude the endometrial neoplasia or endometritis. What are the indications of the endometrial biopsy? If the woman age is more than the 45-year-old and present with the dysfunctional uterine bleeding, then we must rule out the endometrial cancer or premalignant disease by doing endometrial biopsy. Or if the woman present with the less than 45-year-old but present with the abnormal uterine bleeding which was persist and having the failed medical management, or if the patient taking the unopposed estrogen exposure, tamoxifen therapy, or taking the HRT, or having the history of the chronic anovulation, so we must perform the endometrial biopsy to rule out the malignant disease. In addition, the endometrial hyperneoplasia should be suspected in premenopausal women.